Croeso i'r cyfarfod y llawn a conia in the full council. Work in the full council, 6th of January 2021. Please note this meeting is being recorded and may be broadcast via the authority's internet site. The images and sound recording may also be used for training purposes within the authority. So we'll go on to item number 1. Apologies for absence. Any apologies?
All members are present, Mr. Mayor.
I do, that's right, yep. Item 2, declarations of interest. And please note points A and B when you declare that you are interest.
Can I just say at this point that I understand there may be a number of members who are going to wish to declare an interest in item number 6. And that is the adoption of council tax reduction scheme for financial year 2021-22. And the reason why members may be declaring an interest in that item would be because they have claimed that benefit. So if that is why you are declaring an interest and it's that item, can everybody just show hands so the Democratic Services can count them rather than each individual person explain to us? Right, so I can see that 6 people have shown. Can somebody on Democratic tell me if that's right, or are there any more?
Only 6 I can see, Karen. No, yeah, 6 I can see as well. Yeah.
Thank you. So perhaps, Mr. Mayor, if we consider that those are recorded as having been the interests declared, if anybody else has a declaration of interest in any other matter or for any other reason, can they show now, please? There. Thank you, Mr. Mayor. I think that is then all of the declarations of interest that we were expecting to receive, and you can move on with your agenda.
Thank you much, guys. We'll go on now to item number 3, a presentation by the Chief Executive, Cwmtaf Morgannwg University Health Board. We see the presentation from Mr. Paul Mears. Mr. Paul Mears, like to present.
Thank you, Mr. Mayor, and good evening, everybody. I'm actually joined by Marcus Longley, our chairman, and also one of my colleagues, Alan Laurie, who's our director of operations. I was going to ask Marcus to start off and introduce this, and then I'll come in and pick things up. Well, there is a presentation which I believe has been sent through, so I'm hoping colleagues from Democratic Services are going to be able to share that with you on the screen shortly. Is that possible?
Yeah, I called it up on my screen. I think I've opened it. I didn't realise you wanted us
to
share it. Okay, I'll do it now. No problem.
Thank you.
Perhaps I can. Shall I just talk while you're doing the wizardry? Thank you very much. And Mr. Mayor, councillors, thank you very much for inviting us. It's one of the benefits of COVID, I guess, that we're presenting to you today, which I don't think we've done to the full council for quite some time. So thank you very much indeed for inviting us. What we were intending to do really is just to sort of highlight some of the key developments for you, and then really respond to any questions that you've got. I imagine that there'll be quite a few questions, particularly on COVID and everything to do with that, but whatever issues you wish to raise, obviously we're very happy to talk. I don't know whether it's possible to share the presentation, is it?
Can you not see it?
Not at the moment, no. If it's too, I can always try sharing it from my side if that might be easier.
If you've got it open, then it probably would, because then you can change the screen as you want it.
Okay, yes, not a problem at all. No problem at all. Let me just share my screen then, and then I'll apologies for this slight delay. Colleagues see my screen now.
Excellent. Great.
Yes,
Okay.
we can see it now. Yep.
So I'll kick off and then hand back to Paul. So on what you can see in front of you really is just the 6 or 7 issues that we thought we might just touch on in the presentation, which hopefully covers most of the issues that people would want to know about. So on the next slide, let me just talk a little bit about we seem to have lost it, Paul. Sorry.
Oh,
I can't
sorry.
see it, but can others see it or not? Well, I'll continue talking, and then we'll see if we can find it again. So there are just
share the screen inadvertently.
So a few highlights really from the past 12 months, and just to begin with. Colleagues will remember, of course, as we all do, that just before the last year, almost now 2 years ago actually, we had the report from the Royal College of Obstetricians and Gynecologists and the Royal College of Midwives, which revealed a number of serious problems in relation to the maternity service, particularly in Prince Charles Hospital and also in the Royal Glamorgan. And subsequent to that, about a year ago, we had a joint review into quality governance across the health board, which came out in November of 2019, I think. And that, together with the report on maternity services, led the Welsh Government to put the health board into what's called special measures for maternity services, and what's called targeted intervention around issues of quality and governance. So these are 2 related issues, obviously, for the health board, challenges which we have spent a lot of time subsequently addressing under the supervision of the Welsh Government, as colleagues will be aware. So that's the first 2 bullet points on that slide, and those are still major issues for us today, which we'll talk a bit more about in a minute. The third bullet point there is about some of the changes then which we as a health board have been making in the context of the first 2 bullet points, and also in recognition of the fact that we needed to make some changes in the way in which we organise ourselves as a health board to deliver the best possible care we can for our patients. So what we've established in each of the 3 localities across Cwmtaf Morgannwg is what we're called the integrated locality groups. This is really about delegating responsibility for running the health services to the localities where they are provided. Not just health services in terms of hospitals, but also in terms of primary care, community care, mental health services, and really importantly, the whole population health agenda, the prevention agenda, addressing the causes of ill health. So we have now for Merthyr and Cynon an integrated locality group, which essentially is responsible for the day-to-day running of all of those services across those communities. The response to COVID-19 has inevitably dominated much of what we've done really over the last, whatever it is now, 10 months, is it? It seems longer than that. The response to COVID-19, a huge challenge. People will remember when this started back in March last year, there was a lot of real alarm about the ability of the health service to survive, really. We were seeing stories from Italy at the time where the health service was going through enormous pressures, and people were really worried that the health service in the UK wouldn't survive. The great news is that thanks to the fantastic efforts of our staff sustained over all those months and continuing today, not only did the health service survive, but it provided really high quality care considering the enormous pressures which were being thrown at us. Every week we had another challenge around, if you remember, about PPE, about the availability of testing, about the availability of key drugs, and so on and so on. And we're still not, of course, out of the woods there yet. And then a couple of other things which I think are good signs for the future. So Paul, our new Chief Executive Officer, appointed just a few months ago, and Paul's here today, delighted that Paul has joined us and is leading us really into the next stage of our recovery. And the next to last bullet point there is a crucial one. It sounds a little bit jargonistic maybe, but I think it's really important. So the launch of our Cumtaf Organic values and behaviours. This is about working with staff and with patients to generate a small set of issues, values and behaviours that we intend to live by. The things that we think are the hallmarks of the sort of quality of care that people deserve in our communities, and embedding those and making sure we live them day by day, hour by hour, is a huge task for us that we're right in the middle of now. So that's, I think, a really important harbinger of a better future. And then finally, a focus on stakeholder engagement. I think as a health board over the years, we probably got a bit too remote from the communities we serve, and we need to come back alongside those communities, understand what it is that they want and need, and work with them to provide it. So that again is another ongoing task. So those are the key highlights really from the last year. I'll hand back to you, Paul.
Thank you, Marcus. Sorry, I'm just jumping through my slides here. So can everybody hear me okay? Looking forward then into the next 12 months, one of the things I think which has become very apparent, and particularly for me as a new chief executive coming into the organisation, is making sure that we're very clear where we're going in the future. There's been, as Marcus said, quite a lot of hard work done over the past couple of years to make sure that we understand how we're running the organisation, some of the governance questions that we needed to deal with. But I think it's also really important we look to the future and think about what do we want health and care to look like in our local area. We know in our patch we have some significant health challenges, health inequalities, deprivation, poor outcomes for many of our population in terms of their health, and it's really important that we as an organisation work in a joined up way with our colleagues in the local authorities, the voluntary sector, the population at large, community groups and others, to make sure that we are all collectively trying to focus on improving the health and well-being of our population. So we will be working over the next few months really to shape what that model looks like for the future, and be doing that in a very joined up way with colleagues in other stakeholder organisations. As Marcus said, I think we've got a really good model now in place to make sure that much of our work is rooted in local communities. Our locality structure is very much about how do we build relationships between hospitals, GP services, mental health services, social care, community services, so that actually all of the services for the local community are being organised in one place by the health board. And I think there's a great opportunity in Merthyr, particularly to make sure that is taken forward, and a great enthusiasm from our local teams to do that. I'll come and talk a bit more about the COVID challenge, because obviously that is a key pressure for us over the next 12 months. And linked to COVID, really, as many of you will know, one of the biggest challenges we've had in the NHS is because of the pressures of COVID and the beds pressures that's brought, and also the staffing pressures that's brought to us, we have had to cancel a lot of our elective planned surgical procedures. So I'm sure many of you will know of people, friends, local neighbours who've had surgery cancelled because we were not able to bring in the patients. It's really a big challenge for us to think through now how we're going to catch that work up moving forward, particularly at a time where we are currently operating at a very high level of occupancy and have had to stand down nearly all of our elective operating to try and redeploy staff to help manage the response to COVID. I mentioned also the focus on population health, because we also want to make sure that as the NHS locally, we're not just focused on fixing problems when they arise. We very much want to work proactively with our stakeholders and our communities to try and avoid people deteriorating and getting ill in the first place. We've got a very clear focus as an organisation on population health, so trying to intervene early to make sure that we are helping people make healthy choices, live healthier lives, And also, as we know, much of the health challenges that people are living with are not just about their health needs. They're linked to other factors such as their housing, their employment situation, their education, family situation. So it really does require us to think very carefully about how we work, not just as health services, but in partnership with other organisations. And that really plays through to how we can really build on opportunities for integrating care, particularly with adult social care colleagues, thinking about how we can join up services for our local population to make it as easy as possible for people in the community and their families to get care when they need it, and that they're not having to try and navigate across the boundaries between health and social services, which can often be a bit of a challenge for people, particularly at a time of need. And I've also mentioned there about the opportunities from digital. One of the things that COVID has brought to us is a very much a big focus on digital. Many of you will know we've moved a lot of our consultations online, offering digital consultations, GP practices offering over the phone or digital video call consultations. Many of our consultants and specialist nurses and others are delivering consultations using video calling now. And clearly, we know that that doesn't work for everybody, but there are a large number of our patients who do value being able to contact people remotely, and it does mean that people don't have to take time off work to come to appointments and things. So we want to think about how we take the learning from COVID and how we've used digital solutions into the future and make it part of our core business moving forward. Just to touch on COVID, and I don't need to tell you, as the council in Merthyr Tydfil, we know that our area of Wales has been the hardest hit, and indeed probably one of the hardest hit in the UK from COVID. And I would just like to say how positive it has been in terms of working jointly with the council in Merthyr Tydfil to try and deal with this situation. We have weekly calls with the leader and chief executive now, and you have been a fantastic partner in helping us respond to COVID, particularly around things like test, trace and protect. The work we've done jointly on the mass testing before Christmas was a huge effort from everybody across the Health Board and the Council and other colleagues. So thank you to everybody for your support on managing this. But we do have still some significant pressures and challenges, as you know. As I mentioned, our current situation is that all our ITU beds are full across all of our 3 hospitals. We've had to stand down all of our planned care and elective operating to redeploy staff. We've opened a field hospital down in Bridgend, which currently has 74 patients who are all recovering COVID patients being cared for in that facility. So we are still under an immense amount of pressure. And as you know and can imagine, many of our staff themselves are going off sick with COVID or having to self-isolate because of COVID in their families. So clearly, one of the key routes out of this situation is the vaccination programme. The vaccination programme has now begun. It began just before Christmas and has been ramping up. We have currently vaccinated about 8,000 people across the Health Board, and as you'll know, there's a priority list of people that we're working through to vaccinate. Many of those are our own health and social care staff, so colleagues from social care are being offered the vaccination along with people working in residential homes, domiciliary care agencies, residents of care homes, and we're now this week starting to roll out the vaccination programme with our GP colleagues using the new Oxford vaccination that's become available this week. So as of today, we've got 17 GP practices across our patch starting to call their patients in for vaccination, and that will be up to 51 practices next week. So we will start to see, and you will no doubt hear about more and more over the next couple of weeks, many of your friends, neighbours, colleagues who will be being called in for vaccination. So a big focus of work for us at the moment on vaccination. I think the other thing I'd like to say is, again, a really positive relationship with local authority colleagues and council colleagues from social care working on transfers, delayed transfers and discharge. We've done a lot of work with the council over the past few months to make sure that we're trying to manage the discharge process out of hospital as smoothly as possible, recognising that social care has been under a huge amount of pressure as well from COVID in terms of care home closures, domiciliary care agencies with reduced staffing. And again, just thank you to everybody in social care for being really proactive and helpful in trying to manage the situation that we've been dealing with. And Marcus has mentioned, our ambition. We know we want to build healthier communities. That's fundamentally what we're about. And as I said earlier, that's very much something we can't do on our own. And it does require us to work in a joined up way with our colleagues through forums like the Regional Partnership Board, but also on an operational level on a day-to-day basis. And one of the areas we work very jointly with local authority colleagues on is our winter plan. And I was just going to bring Alan, our Director of Ops, in to now just give you talk you through our winter plan, and also just give you an overview of some of the work we're doing in our primary care area around GP services. So Alan, did you want to just talk to this slide?
Great, thank you very much, Paul. Yeah, it's fair to say that we have had for a long time a very good working relationship between the Health Board and Merthyr Tydfil Council, and none more so than in this year. We began working on an integrated winter plan back in sort of the hottest parts of the summer in August, as we normally do with colleagues. We refined that over the September period to make sure that our winter plan was in line with the Welsh Government winter protection plan that was published in September. And then finally, through the RPB, we submitted a winter plan into government, and as part of that we had just under £11 million. That's more money than we've ever put as a partnership into winter planning, and that was a very good thing and a very necessary thing. You will see on the slide the sorts of things that we were investing in across the CTM area in terms of community care and enhanced primary care, but more importantly, issues in mental health, enhanced capacity within our emergency departments, trying to ensure we had significant levels of what they call ambulatory care, the ability to turn people around at the front door, and even more importantly, that kind of rapid discharge. Of the £11 million or so, £3 million came to the Merthyr Cynnon ILG. Probably about £2 million of that went into schemes and ideas and teams within PCH itself. About £200,000 in the voluntary sector, and then about £300,000 each between the Cynnon element, which would be through RCT, and £300,000 into the Merthyr Tydfil element. And Lisa Curtis-Jones and Angela Edivan were at the head of that in terms of allocating where those monies went into things like at-home services, crisis services for carers, additional placements, and additional social work capacity, which we know we desperately need over the period. I think the RPB recognised that it was a good plan, well put together in a partnership way, but the key thing was always going to be workforce within the health service, but also a workforce within social care. And we know between ourselves as partners, we've had significant numbers of staff who have been off with COVID, who have been socially isolating or caring for family members, and the figures are up to 20% of the workforce off at any one point in time, which has been a real strain for services and for those who are in those services. And we very much welcome the partnership with them, but supporting the staff that are there. And I can't echo again as much as Paul has said that the excellent work we've had with colleagues. We wouldn't be in the position we're in today had it not been for the excellent work with all three local authorities at this time this year. Moving into the primary care slide, you will spot immediately the deliberate mistake. Abercwmboi is not part of Merthyr Tydfil. I do know it's in the Cynnon. I should have checked the slide before it got sent in, so my sincere apologies there. And whilst we're on that slide, there are two single-handed practices that are beginning to merge together, Oakland Surgery and the Primary Care Centre in Treharris. That's beginning in January 21. And when they merge together, and they will, that will not leave us with two single-handed practices, it will leave us with no single-handed practices. And that's a very good position. And I do remember for many years ago, there were a number of single-handed practices within the Merthyr Tydfil area, getting to the point where we've got very strong, robust primary care is very important. And I do know that primary care in the Merthyr Tydfil area has been growing and growing in strength over the past years. We do have those practices working together as cluster networks, and some of those cluster networks have been very innovative in terms of developing what they call the multidisciplinary team, including our GP support officers who work very closely with colleagues in social work. There's some narrative there in relation to a number of dental practices, optometry practices and community pharmacies, which is important. And a really important point, I think, for colleagues in Merthyr Tydfil would be the out-of-hours provision. A number of you will know we struggled for quite some time back in 2017 and 2018 to get GPs to work within the PCH area, often having to close our primary care centre there at weekends. Not a good experience for patients, not a good experience in affecting some of the pressure in the ED. We have managed over the course of the last 18 months to keep that service open at 100% fill rate there or thereabouts nearly every weekend. And I think that's been a very big move forward. And I hope that's helped. I'm sure that has helped the patients locally, but it also has helped us in terms of flow through our emergency department. Last but by no means least, just linking back to Paul's point around COVID, it was Ponkai, just down the road from yourselves, that was obviously one of the first practices to be giving out the AstraZeneca vaccine to the world's news, as it turned out to be on Monday. So that's a really good move forward. And I'll leave it there, Paul.
Yeah, thanks, Alan. I thought it'd also be just useful to update colleagues on one of the big developments that's on the cards in your local area. Many of you will know we've been doing a lot of work at Prince Charles Hospital over the past few years, and I'm pleased to say that much of that work is coming to fruition now, with the new pharmacy department and new main kitchens and restaurant being opened imminently in 2021. In October last year, we got approval from Welsh Government for our full business case for £220 million worth of capital monies to be invested in Prince Charles Hospital over the next 5 years. This is going to be a major change and improvement to the hospital, and is going to provide a lot of improved clinical areas in theatres, critical care, pathology. You can see all the various areas written down there. So a really big improvement programme for the hospital, which I think will be a great benefit to the local community, but also a great benefit to our staff who work at the hospital. It's always great to be able to invest in the buildings, not just for our patients, but also for our staff that work there. And we'll also be looking at how we improve our capacity for car parking, because I know that can be a particular pressure point at Prince Charles. But I just thought it'd be worth reminding ourselves that we've had some good news, despite all the COVID challenges, of what we're going to be able to do with Prince Charles moving forward. Marcus mentioned at the beginning about the work we've done on maternity over the past couple of years following the Royal College of Review. We've done a huge amount of work to improve our maternity services in Cwmtaf Morgannwg. There was an action plan developed out of the review which had 70 recommendations, and we've now already implemented 50 of those 70 recommendations, with plans in place to implement the further 20, which are much more sort of longer term recommendations that we need to work on. There's a lot of work going on, not just in maternity, but also neonatal services, to make sure that we are improving the care we provide for premature babies. And we are also just in the process of contacting many of the women whose care was identified as being suboptimal by the review, to talk them through the process we've gone through to review their care and make sure that they are fully aware of how we're investigating any issues that may have arisen. So a lot of very detailed work going on in maternity, some great efforts by the maternity teams to improve things, and a real commitment from our maternity service to make sure that we learn from the Royal College Review and improve the care we provide to local women and their families. So just moving forward, continuing to manage the COVID-19 pandemic is a key priority for us, obviously. Continuing to work with yourselves and the council on how we can develop further integration between health and social care, absolutely a priority, and learning from the work we've done already on population health and building that out into the wider community. Looking at how we can try and get upstream and prevent people getting ill in the first place and improve health outcomes is clearly a priority, and obviously carry on our strong engagement and involvement with colleagues in the council on key service developments, and I should say not just in adult services but in children's services as well as adults. So that was the presentation I was going to give, and would welcome any questions.
Thank you very much for the presentation. Members, have got any questions? I see Geraint Thomas.
Thank you, Mr. Mayor, and thank you very much for the presentation. It was very enlightening. And I know a lot of my colleagues are going to talk a lot more on the health side of things. But as the Cabinet Member for Regeneration and Economic Development for Merthyr, I'm quite interested in the investment that's going into Prince Charles Hospital. I think that's very welcome. And what it really says, it makes a statement that Prince Charles Hospital and Merthyr Tydfil is the regional centre for health in the Edge of the Valleys area. But what I'd like to ask you is what kind of structure you can put in place to support some of the local businesses in the area. You know, it's a huge investment. During the pandemic, a lot of our companies have struggled. A lot of the building companies have struggled. And it'd be really, really interesting to see, and it'd be a positive move by the Trust, I think, if you encourage a certain percentage of your spend with local companies.
Yeah, thank you, Councillor. It's a really good point, and I think I have to double check, but I'm pretty sure in our contract in our arrangements with our contractors, we have specified certain requirements to engage local suppliers in the work. So obviously it goes out to contract and tender and things, but I think we've specified that a certain portion of that labour and supply needs to come from the local area. But it's a really good point, not just about this Prince Charles development, but as a large employer in the local community, where I'm really aware that we have a corporate responsibility to support as much as possible employment opportunities for local people, whether that's in terms of supply chain, where we are buying services from local companies, or indeed looking at opportunities for creating employment for local people. And I think particularly now in the hopefully post-COVID period, we know there's going to be a particularly significant impact for a lot of our communities in terms of people who've lost their jobs because of COVID and business closures and things. So we are very much thinking about how we can try and make sure local people are aware of opportunities within the Health Board for employment, because it isn't just about doctors and nurses. There are lots of other job opportunities within the Health Board, whether that's administration, IT, HR, and making sure that we try and provide routes for local people in where they might need a bit of extra training to help them in that. So both from a supply side, we are doing that, and also looking at that from an employment perspective.
Mr. Mayor, Councillor Chris Barry was the next to indicate.
Okay, Councillor Chris Barry, or Gavin still talking?
Can I? Yeah, sorry, I put myself on mute then when Paul was speaking. And thank you for that, Paul. It's very encouraging. And I know that the regeneration department and in the council would be willing to help to work with you to identify that as well. So thank you very much. That's really positive.
Thank you. We'll follow that up with Ellis and colleagues in the regeneration team.
Councillor Chris Barry.
Yeah, thank you, Mr. Mayor, and thanks Paul and Mark and Alan for that presentation. I say now I've worked for the health service for almost 40 years now, and I'm not clinical or frontline like some of my colleagues in the council, but I've been around a very long time. I visit all sites quite regularly, and I've never, well, all my colleagues, we've never experienced anything like the current situation we're going through. And I've got to say, struggle we have, the performance of the Health Board and all its staff has been nothing short of heroic. The pressure that the staff are working under and consistently producing good results is outstanding. Got to say though, the staff are now physically, well, they're exhausted, both physically, especially those who've had COVID and have come back to work and are struggling through it, and emotionally. And unfortunately, the emotional exhaustion is caused by the lunatics outside who seem to think we're involved in some conspiracy and there is no illness. And I just love it if you could invite them along to visit the hospital without the benefit of any PPE. Just a quick point, I'm delighted you mentioned car parking, because that's a big part of my job and has been the bane of my life for a long time. So I will welcome any improvement in car parking. But Mr. Mayor, basically, I think only the vaccine can save us now. And thank God it's come when it has, because I don't know how much longer we could go on. I'm fully aware of all the work that's gone into setting up the 2 vaccination centres that we currently got, and that we are setting up further ones for the coming weeks. But the vaccination centres and the staff are only as good as the supply of the vaccines that we're going to get. Are we confident that we'll get a consistent supply of adequate vaccines when we need it, well, as soon as possible, to vaccinate our population? And the other question, and I'm personally interested in this, can we be sure that all those who had the first Pfizer vaccine and had the second appointment cancelled will indeed get the second Pfizer vaccination within the timescale? Thank you.
Thanks, Councillor. So just to answer the questions about supply, I've literally, before this meeting, been on a call with Welsh Government, with other chief execs, talking about this very topic. As you can imagine, it is very much a moving on a daily basis at the moment, because it's only since Monday that we've had the Oxford AstraZeneca vaccine available to us. We are getting regular supplies at the moment, and at the moment we are getting what we need. It is a challenging supply chain though, because as you may know, the vaccine, when it comes off the production line, has to be batch checked by the MHRA, the regulator. So it isn't just as straightforward as it just flies off the shelves and straight out into the to the health boards. Having said that, you know, we are in regular contact with the supply, with the Welsh Government people who are organising the supply, and they're assuring us that we will have enough to do the people we want to do at the moment. But as I said, it's a very moving feast at the moment. In terms of the second dose issue, this is just to explain to other councillors. You may be aware that both the vaccinations get given with 2 doses, and obviously the Pfizer vaccine, which came out first, many of our staff have had their first dose, and initially we thought we were going to be able to vaccinate with a second dose within 28 days. The recent guidance has changed on that on the 31st of December. And the recommendation now UK-wide from the the Committee on Vaccination and Immunisation is that we should try and vaccinate as many people as possible with the first dose of the Pfizer vaccine. So that has meant that for some staff that have had the first dose, we've had to push back the date of their second dose by a few weeks. But we are very assured and are confident that everybody will get the second dose of the Pfizer vaccine within the required time frame to ensure its efficacy. So yeah, that is being guaranteed to us by Welsh Government.
Mr Mayor, you next had Councillor David Isaac indicate to speak.
Councillor David Isaac.
Yes, thank you, Mr Mayor, and thank you for your presentation, gentlemen. Can I ask the impact that the Grange Hospital has caused for the trust, seeing it's now opened? What is the board doing about the influx of people from the Powys and Aneurin Bevan areas and the problems they caused by taking bed space for the Merthyr and Cynon residents that actually go to Prince Charles? This has been proved time and time again by the amount of ambulances that are being queued up outside waiting for bed space, that if these people hadn't been there, could have been given to our residents.
Alan, did you want to come in on this? Because I know this is something you've been quite involved in.
Yeah, absolutely. So there's a couple of things in there, Councillor. The first is that part of the old South Wales programme, it was always the case that the Powys residents from South Powys were going to be flowing into Prince Charles Hospital. But the view was from Aneurin Bevan that there would not be additional patients coming in from their area. With the opening of the Grange a little earlier than had been anticipated, some of the detailed planning around that, a lot of the detailed planning around that had to be done at quite a pace and on the hoof. I absolutely accept. From a Powys perspective, the numbers, we're tracking them on a daily basis, are relatively small. The figures that are coming in from Aneurin Bevan are quite variable. So in some days it's less than it has been, and some days it's more. And it's quite clear from the clinical evidence that's coming forward that a number of the patients that are coming in from Aneurin Bevan are probably sicker than they would have been, because it's the red calls from the ambulances and the amber ones where they're more serious conditions. We do know that we'll get additional money through what they call the commissioning flows, and we're kind of putting the money to one side and saying if we need to have additional staffing, so there is the prospects of some additional emergency department consultants, we want to have some more respiratory consultants, some more acute physicians, and to go with that, the nursing staff and the ancillary staff that goes with that, we do know the money will be coming, and therefore to some extent we are beginning to staff up in relation to that. But we had to act quickly because the Grange was opening on the 16th of November. The clinical teams are operating that on a day and daily basis and watching that on a day and daily basis. We have done a little bit of movement on the edges. So what we've done with the ambulance service is look at patients who may have come to PCH from the Abercynon and sort of Penrith Khyber area. They would normally have gone to PCH. They are now going down to the Royal Glamorgan. It's relatively small numbers, but that's taking a little bit of pressure away. And Aneurin Bevan is also looking at some of the patients from the Caerphilly area that would have normally come into PCH going into the Grange, because the Grange itself has been having its own teething issues that you have seen. Some of the ambulance delay issues are absolutely about beds, or the right sorts of beds. There are often beds available in the hospital, but they are not either COVID beds or non-COVID beds. And there's an awful lot of work done daily by our staff in terms of moving around the ward configurations to make sure they can accommodate that. Together with the fact that we need to ensure when a patient comes forward with suspected COVID symptoms that they are actually COVID positive, and the swabbing has been a bit of an issue in relation to that as well. So there's a whole range of things been going on at PCH. I have to say the clinical and the site team have been working miracles to keep the place running as well as it has been. We are monitoring it and making sure that if there is additional flow from an Iron Bevan, that we are pushing it back if we need to be, and then we're investing in the staff going forward in due course around that. So it is a difficult situation. It was always going to happen. It's happened earlier than we anticipated, and I have to say again, credit to teams on site in Prince Charles in relation to the way in which they're handling it.
Mr. Mayor, your next question is from Councillor Chris Davis.
Councillor Chris Davis, your questions, please.
Thank you, Mr. Mayor. Paul, Alan and Marcus, thank you for joining us this evening. My question follows on actually quite nicely from Councillor Isaacs, and I've been concerned about that patient flow you've just described, Alan, really, from the tarmac at the front of PCH in the ED department, where those ambulances that Councillor Isaac has described have stacked up over what's been a difficult period for you, but looking for some reassurance really and some idea of the strategy of how, because when those ambulances are stacking up there at PCH, and I know there's been periods throughout recent months where they have stacked up in large numbers, they're not out dealing potentially with cardiac arrests and obviously out in the community meeting the needs as an emergency service at the frontline community. So I want to be reassured really that your strategy, that you've got the resources and that you've got the staffing and the capacity to cope with that, because the transfer of those patients from that ambulance and that paramedic to your frontline staff in emergency departments and critical care and the medical admissions unit is an absolute priority, because we talk about saving lives within district general hospital sites. It's also about saving lives when ambulances can't get to people who are having cardiac arrest. So if you could just talk us through what the strategy for the health board, getting people off the ambulances and getting them obviously into the facilities, handed over to your nursing and medical staff to have the care that and assessments that they need.
Okay. Thank you, Councillor. The strategy, I suppose, is multifactorial, Councillor Davis. The first is that when there is a red call, then they have something called a red release protocol, and in effect, patients should be brought in and found the nearest space. And I know for a fact that in PCH there have been very few times, even in the course of the last 6 or 8 weeks, where they have not been able to achieve a red release around that, and where they have, that's very clearly documented, and the reasons for that. And there have been times when the ED has been completely full, resus has been completely full, and that hasn't happened, but that's been a very small number of occasions. But it does mean that there are patients who are delayed longer in the community than anyone would want. We watch that flow across all 3 sites on an hour-to-hour basis. So if pressure is building up in Prince Charles Hospital and we've got capacity in the Royal Glamorgan, then we will divert ambulances via ambulance control from the borders, probably from the borders, and often depending on the specialty, is it a medical sort of issue or a surgical sort of issue, either down to the Royal Glamorgan, sometimes over to Neville Hall, and on occasions they have been going back to the Grange. So that's monitored by the sites, as I say. Well, I was going to say hourly. It's probably more than hourly. It's on a half-hourly basis. They're making sure that if they can move patients around and to ensure that they can do that appropriately, then they do that. Clearly, making sure that we get patients back to Powys and back to an Iron Bevan when they come in is key for us. So there's been some very good operational clinical conversations that have taken place with colleagues from Powys, and I have to say, having worked in Powys previously, we probably were a little bit tardy sometimes at taking patients back from Prince Charles. That has changed. That has changed a lot. I don't think it's just because I've arrived in Cwmtarf. It is very much that they have got space in Brecon Hospital. They're getting their community resource teams to take patients back, and that's been working really well. We haven't quite solved that with an Iron Bevan, I have to be very honest with you. And there are ongoing clinical conversations with our colleagues in the Grange and in Neville Hall in terms of how we get patients who can be returned into their area, returned into one of their respite or step down facilities more quickly. There is more work to be done over the course of the next sort of 6 to 8 weeks around that. So that's that part of the strategy for us, really, is making sure once a patient comes in and has been treated, that we can actually return them to where they need to as quickly as possible. Because if they stay in hospital longer and longer, the length of stay is going up, they deteriorate, that's not good for them, and then it causes that congestion at the front door. So there's a number of both tactical things that are done on a daily basis, Chris, and also a number of strategic things that we're working through. I have to say, it is on the Health Board's risk register as one of our top risks. So the Health Board is well cited on that, and I'm cited on a daily basis with the ILG team in relation to pressures around that.
Thank you, Mr. Mayor. Thank you for that really comprehensive reply, Alan. Cheers.
Mr. Mayor, your next question, the next person to indicate is Councillor Malcolm Colbrand.
Councillor Colbrand, give a question, please.
Yes, thank you, Mr. Mayor. Yes, evening all. I represent Bedlinog Ward, and obviously I've had people coming to me regarding the merger of Oakland Surgery with Treharris Primary Care, and just want reassurances that the service level in Bedlinog is not going to be diminished as a result of this merger, and hopefully, in fact, improved, and we'll have greater access to services.
Thank you, Councillor. Yes, I mean, I would want to give the absolute reassurance that on any occasion where we have brought single-handed practices together, that the service that results from that is got to be better and more resilient for patients. If it's not better and more resilient for patients, we shouldn't be doing that. And I will go back to the primary care team to make sure that they are providing you with the reassurance, Councillor, and your patients that is the case, because we should not be doing it if actually it does not end up with a more resilient primary care service. I have to say, it has been the practice across Cwmtarth and now Cwmtarth Morgannwg to look to try to create more resilient practices. Single-handed practices they're great at one level, and they have real complexity and concern and fragility at another level. If that single-handed practitioner falls ill or has to be away for a period of time, you end up with locums, and that's not necessarily good. So the strategy has always been not to push people, but where people want to join together, making sure they can, so it makes a more resilient primary care team, and as I say, a better and more resilient service for patients. If there are any specific issues, Councillor, be very happy to pick the specific issues up outside of the meeting.
Okay, thank you very much.
Mr. Mayor, the next person I can see indicating is Councillor Julian Amos.
Councillor Amos.
Thank you, Mr. Mayor. First of all, I'd like to thank you all for your presentation, and I think it would be very nice if thanks to this council went to all of the staff up there who are coping with this dreadful crisis. That's from the ancillary staff right up to the senior medical staff. I echo what Councillor Barry said, that I think it's dreadful that there are some people who think there's some conspiracy and whatever. My question is, I've heard on the news that when it comes to the vaccine programme, the first jab could be the Pfizer vaccine, and then the second jab could be the other one, the Zeneca vaccine. It's been on the news, and I know they were saying the UK were doing it, but the USA were not. Can you just clarify that for me?
Certainly, Councillor. Just to be clear, I'm going to check the news that where that came from, because we're up with the guidance that we've been given is absolutely not that if you've had the first dose of Pfizer, your second dose will be Pfizer. If you had first dose Oxford, second dose will be Oxford. Absolutely not mixing the two vaccines. So I'm not sure where that's been got, and part of I mean, I'll be honest, this is part of the challenge we face at the moment. There is so much information out there across news outlets, social media, etc., and a lot of what we're trying to do at the moment is manage messages to both our staff and our communities, and we will be writing out jointly with the local authority leaders soon to all households across CTM, and in fact across Wales. All health boards are doing the same, to give updates to to communities and members of the public about the vaccination programme to try and deal with some of these issues, because just to be clear, that is absolutely not accurate. So I'm sorry if that's been portrayed in the media as such, because it's absolutely not the clinical advice we've been told.
Mr. Mayor, I think your next question would be from Councillor Clive Jones.
Councillor Jones, questions, please.
Yes, thank you, Mr. Mayor. I've got two questions. The first one is, it's been touched upon, is relation to the actual rollout of the vaccine on a mass scale in the community. I understand general letters will be sent out to everyone entitled to a vaccine, and then maybe a specific letter given an appointment to the individual. Will the vaccine programme be provided on 7 days a week, every week, until all those who are on the list, certainly down until the age of 50, and all the vulnerable people? Clearly, there is a race against time for CTM as the highest death rate and the highest number of infections in the whole of Wales.
Thank you, Councillor. Yes, so just to clarify, several things are going on. So a letter's going out to all residents across the 3 council areas in CTM, and that is going to explain the vaccination programme. So every resident, regardless of whether they're on a priority list or not, will get a letter explaining how we're going to be managing the vaccination programme. Then everybody who is in an at-risk group, so as you'll know, there's a criteria. It starts with the over 80s, people in care homes, and then works its way down. Those patients will, in the majority, be contacted by their local GP practice, and they will be phoned or sent a letter and asked to make an appointment to come in. They don't need to phone themselves, proactively. They will be contacted when their practice has got to them on the list, if you like. So they will be receiving that in the next few days. It's already started. GP practices are already vaccinating, so they're already starting to call people in. At the moment, and in parallel with that, we will also be operating 3 mass vaccination centres. There are 2 already running one in Abercynon, one down in Bridgend, and the one in Merthyr will be starting the week on the 18th of January. And those will be operating at the moment 5 days a week, but then we are looking at how we could make them 7 days a week as well, and that will provide additional capacity for us to be able to vaccinate further populations as we go through. So as we get into this territory of vaccinating, for example, other key workers and people who aren't on the priority list, those will be the sorts of places where we will be able to bring in those members of the public in to get their vaccination. So we are ramping this up very quickly. I should say, one of the challenges is the limiting factor is staffing these centres, because clearly we've got to have enough people to be able to vaccinate. We've got 45 additional staff who are already employed to work on this. Your council colleagues, both in all 3 councils, have been very generous and offered any administrative support from the councils to help run the process, because clearly there's a big admin process around all of this, in booking people in, making sure people have got all the right consent forms done, etc., etc. So we've got a lot of work to do to get this up and running at a scale, but we are very much working on it at the moment. And I should also say we're having help from the military as well to help on the logistics of this as well. So it really is going to be a mammoth effort. But as you rightly say, we've got to get through a large number of people. If you look at the first 4 categories of people on the prioritisation list, so that's the over 80s, care homes, over 75s, over 70s, across Cwmtaf Morgannwg, we've got 50,000 people in those first 4 categories. We've done 8,000 people already. But that means we've got 42,000 people to go through very quickly. So that's a lot of people to get through the vaccination programme. Having said all of that, GPs are very, very used to running large-scale vaccinations. They do the flu vaccination campaign every year very successfully and are used to running that. So I'm very confident that we will be able to get through a large volume of people very quickly.
Thank you for that comprehensive answer. The second question has been touched upon by other council members. I'm a former independent member of the previous Cwmtaf Health Board, and during that time a protocol was negotiated between the Health Board, I think, and the Ambulance Trust. For example, for treble 9 vehicles would only be used within the Health Board area. As a result of the pressures you've got at the moment with COVID, etc., has that protocol now been suspended?
Alan, I don't know. Did you want to?
You're absolutely right, Councillor Jones. There was absolutely a protocol for Cwmtarf ambulances to stay in the Cwmtarf area, and that did wonders in terms of improving the red core performance. Because we did the same thing in Powys as well. I have to say, fairly recently, that was taken down by WAST as a result of the overall regional pressures that they had across the piece between CTM, Cardiff and an Iron Bevan, that they just could not continue to work on the basis that a CT ambulance stayed in the CT area. Now, I have to say, I think in the main, that still happens, but we do, and sometimes it's in our, it has been in our interests that the boundary is flexed. For example, down in Bridgend, for patients in the Vale going to UHW, or patients over at the west side of Bridgend going into Morriston, and the same we have had. In fairness, we've had patients who are up in who would have normally gone to PCH being diverted into Neville Hall prior to the Grange opening and back to the Grange. So I think it's something we're going to have to get back on the table in due course. But as it stands right now, they're seeing it very much as a national or a southeast region resource. And I have to say the pressure for the ambulance service, together with the sort of the three big health boards in that area, has been so immense, and the need to be very dynamic and agile around that. I along with others, have been on calls where you're being woken, you're up at 2 and 3 in the morning having calls about where things get moved. So they just couldn't keep that level of ring around it, if that makes sense. But I think once we get beyond this, we've got to get back to that, because it was absolutely effective in terms of improving red core performance. You're absolutely right.
Thank you very much.
Mr. Mayor, there are no other hands indicating to speak now.
Thank you, gentlemen. Thank you for your marvellous presentation. Thank you on all the answers. Councillor Lisa Bitton, do you want to say something?
If I would, Mr. Mayor, if you allow me to. Well, guys, Paul and Marcus, as you know, I've met you over the last couple of days, but to Alan as well. Firstly, let me just touch upon that report regarding the investment in Prince Charles Hospital. Obviously, overwhelmingly welcomed here in Merthyr Tydfil, as you can imagine. And I think some really good questions put to you tonight as well with regards to that. And of course, we will welcome that maternity report as well, you know, because it did affect a lot of families here in Merthyr Tydfil, and of course throughout the health board area. Gosh, unprecedented times in the last 12 months. What I would like to say is I would like to echo your remarks regarding not only staff here at the local council, but staff from our partners as well, who all pulled together, especially for that mass testing that we had, and obviously the leadership team and cabinet and our offices at Merthyr Tydfil County Borough Council, really pulling together, working with yourselves, of course, the army, police, etc. You know, and that really was so successful. And as you know, having met with you, Paul, on Monday and Marcus yesterday as well, you have our ongoing support with regards to any mass vaccination, as you've already alluded to, with regards to the administrative support as well. But I just want to reassure you that the leadership continues here, and that you still have that commitment from me and my cabinet and our senior officers, and of course Ellis, who's been in those meetings with me as well. So I just want to give you that reassurance. Thank you all once again for this presentation, and not forgetting, of course, Kelechi as well, who I've met a number of times, but also gave me those updates on Monday and Tuesday of this week. And for my wider colleagues, just to reassure you that the reports that Paul has also alluded to with regards to updates on COVID, this new strain, but also on the vaccination, you know, I'll make sure that that is shared with everybody. And of course my opposition leader as well, Darren Roberts, I'll make sure that that gets out so everybody has sight of that ongoing. What I would like to do just before I do finish is just say yes, thank you to all of the NHS staff and all of the Cwmtarf local health board staff and everybody who works behind the scenes as well. I think Councillor Chris Barry, you know, should remember that if he didn't do what he did, then things wouldn't run smoothly as well. So my thanks to those councillor colleagues who are here, Councillor Clive Tivy, Councillor David Isaac and Councillor Chris Barry. And apologies if I miss anybody else. I was trying to think furiously if any of my other colleagues were classed as key workers or blue light workers as such, you know, but we really do have some councillors here who've been at the very front line of things. So thank you all, and thank you for that presentation. Very much welcomed, and I look forward to continuing to work with you. Thank you.
Thank you, Councillor.
Thank you, gentlemen. You are invited to stay for the rest of the meeting if you want to. I don't know, but I will thank you on behalf of us all. Thank you very, very much. Thank you.
Thank you very much, Mr. Mayor. Thank you. Bye-bye.
All right, we'll move on now to item 4, items 4A to 4G, minutes of the previous meetings, to approve as accurate the minutes of the meetings. Do we have a mover?
Yes, Mr. Mayor, I wish to move the accuracy of those minutes. Thank you.
Do we have a seconder?
I'll second those, Mr. Chair, Mr. Mayor. Thank you.
Very good. Caris, you.
Yes, so if we just take that to the vote, and we will, even on this issue, we'll go through in the way that I have said so nobody gets confused. So first of all, if anybody wishes to abstain on that item, could you show now? Thank you. Anybody who wishes to vote against that item, please show now. Thank you. And anybody voting for that item, please show now. I think somebody has their mic open. If they can just close that for me, thank you. Democratic Services, I think we are just about complete now, aren't we?
Yeah, we've got a couple of councillors who have, who haven't voted. So we haven't got the full, and I just want to clarify as well, Councillor Ian Thomas, you look like you voted early to agree with it, but we couldn't tell if you abstained or would have go voting for. Could you confirm, please?
I agreed.
Lovely, thank you.
So that is carried. Thank you. Can we move on, Mr. Mayor, to the next item?
Yep. We go on to item number 5, pay policy amended statement. I'll ask Councillor Andrew Barry. Can I invite you to address the council, please?
Thank you, Mr. Mayor. This is the pay policy amended statement 2021. The report seeks approval for full council this evening to amend the pay policy statement under section 39 of the Act from the 1st of this month, January 21st, 2021. In light of the whole town testing programme. The programme ran between Saturday the 21st of November to the 10th of December. The programme was then extended by an additional week between the 14th of December to the 18th of December. Staff that volunteered at the mass testing sites in the initial phase were to receive an honorarium payment in accordance with section 10 of the pay policy statement, highlighted in your papers at 3.7. And at 3.8, you see the rationale for the report this evening, in that those volunteers having received an initial payment could not be paid a payment for the extension due to the pay policy at clause 10.8, preventing more than one honorarium payment being made to staff within a 12-month period. Staff were paid for the initial mass testing in December's pay run. However, the extension period fell outside the pay window for December in accordance with the current policy, and consequently staff would have been unable to receive an honorarium payment for the extension period. Back in December, there was a flurry of activity whilst Fran Donnelly, the leader Kevin O'Neill, myself, Cabinet consulted with Councillor Darren Roberts, Clive Jones, the opposition leader and deputy, with trade unions to ensure we have this amendment to the pay policy to allow 2 honorarium payments to be made during the financial year 2021, where staff are responding to additional pressures resulting from COVID-19 outlined in paragraph 4.5. We have lobbied Welsh Government to financially support the programme of whole town testing for Merthyr Tydfil. The programme is seen as a pilot for Wales and not just for the benefit of Merthyr, and that has been granted, so there are no financial implications for the authority. So if I take us to the recommendations, Mr. Mayor, at 2.1, the implementation of the pay policy amended statement 2021 from the 1st of January 2021 be approved. 2.2, the publication of the pay policy amended statement 2021 as soon as reasonably practical be approved. I move, Mr. Mayor.
Thank you, Mr. Mayor. Do you have a seconder?
Yes, I second that, Mr. Mayor. Thank you.
Thank you. Members, any questions?
There are no questions, Mr. Mayor.
Any comments?
There are no comments, Mr. Mayor.
Okay, then Alice, we'll go to the vote.
Yes, so can I ask all members who wish to abstain, please show now. Thank you. All members who are against the recommendations, please show now. Thank you. And all those voting in favour of the recommendations, please show now. And I think that is a complete and unanimous vote, Mr. Mayor. So that's carried. Members, we now have a situation where everybody who has declared an interest in item number 6 will need, if they would please, to close down their cameras and switch off their microphones. And members, what I have to tell you is that that leaves us in a situation where both the Mayor and the Deputy Mayor have declared an interest in this matter. So in some discussions prior to our meeting this evening and with the agreement of the Leader of the Opposition, I think Councillor Geraint Thomas is going to step into the chair and chair the meeting for this matter. So Councillor Geraint Thomas, are you there?
Yes, Carlos, I'm here.
Thank you. So Councillor Geraint Thomas, if you could just read out the item that we're going to consider, and then Councillor Andrew Barry is going to take it.
Thank you, Moderator Officer. The item is the adoption of council tax reduction scheme for the financial year 2021-22, and Councillor Andrew Barry is going to present it.
Thank you, Councillor Thomas. This is the adoption of council tax reduction schemes for financial year 2021.
Sorry, Barry, can I just stop you for a moment?
Yep.
We seem to be having an awful lot of feedback, so I don't know if anybody who's not speaking, can they please mute their microphone?
Okay.
And, sorry, Councillor Barry, can you try again?
Yeah, no, yeah, so it's the adoption of the council tax reduction scheme for financial year 2021. This is an annual report in relation to the scheme applied to financial year 2021-22. We are time-bound for the setting of this report to the 31st of January, moving to a default setting should we miss that deadline. The additionality of this authority's scheme is outlined in 3.2 and relates to returning to work, war disablement and widows' pensions, and instances of backdated applications. The recommendations of 2.1 are the adoption of a council tax reduction scheme to commence in April 2021 under the requirements of the prescribed requirements regulations for the 2021-22 financial year be approved. I move, Councillor Thomas.
Any seconder?
I second that, Councillor Thomas.
Any questions?
No, Chair, I can't see any questions indicated.
Thank you. Any comments?
Again, no comments indicated.
So should we go to the vote?
Yes. So again, if we can just move through in the way that we have before. So could those who are seeking to abstain on that matter, could you please show now? Thank you. If anybody is voting against that matter, could you please show now? Thank you. And all those voting in favour of that matter, can you please show now? And that is complete, and that is carried unanimously. So thank you very much, Councillor Thomas. I hope that those who declared an interest are still listening and will be able to rejoin, and that in particular the Mayor is going to rejoin us so that he can resume chairing the Council. Thank you, Mr. Mayor. We are then on to item 7, I believe.
Yep. As you can see, members, item 7 is an information report. So, and then we go on to item 8 to deal with any urgent business or correspondence. We have an additional item which is added to the agenda today. Decision of the Adjudication Panel of Wales in respect of a complaint about elected member. This report is information only, so will not be debated. We'll go on to item 9 to receive communication received by His Worship the Mayor. I have no communications. So on behalf of everybody, I'd like to thank you. That was the last item on the agenda. Meeting closed. Thank you very much.
Thank you, Mr. Mayor.
Thank you, Mr. Mayor.
Thank you, Mr. Mayor. Thank you, Mr. Mayor.
Thank you, Mr. Mayor.
Thank you, Mr. Mayor. Take care, everybody. See you soon.
Take care.
Thank you, Mayor.
Thank you, Howard.
Bye.
Thank you.
It's like John Boy, innit?